So thank you
Yeah,
for making the time. This is so awesome. Like I'm in New York City. I was just right in the corner, and the timing worked out perfect. So this is awesome.
it is. It's a small miracle when these in-person encounters can happen.
And congratulations on your New York Times bestseller.
Thank you. It's shocking and awesome because we did it. It's like a real
With no mass media,
effort.
right? That's
no, not a minute.
No mass media.
Mainstream.
So just in case for those of you who missed out, Dr. Kelly Brogan has not been able to get on any big television stations for good reason.
They all asked for the book, The Galley. This is months ago. And the expectation on the part of my publisher was that I would just waltz on, Today's Show and Dr. Oz in 60 Minutes. And they asked for The Galley, and then we got the no's one after another. And in fact, we got one network said that if we were to cover this book, it would be negative press, so we're doing a favor.
Wow.
I expected that because they're all sponsored, right, by pharmaceutical industry that I take on in this book, so it makes sense.
Yeah, I mean, I remember moving to the United States. One of the shockers for me was just to see how many antidepressants were advertised on television, especially late night television. I mean, that's how networks make their money, and I came from advertising. So, it's not surprising that has happened. But what is amazing is that on the flip side is that you got such incredible support as an underdog from people, from a lot of practitioners, right? And you hit the New York Times bestseller and people's fascination with you. So that's amazing.
Yeah, it's the power of new media, right? We're changing the game, and it's very exciting because I think there's a real readiness for a different perspective on some of the information we've been getting from mainstream.
Let me ask you, what did you have for breakfast today?
So it's really funny because I spend a lot of time writing and researching, right? I love to write, and sometimes it'll take me 2-3 weeks to write one blog, right? And my most viral post I've ever created took me, I think, 5 or 6 minutes on the train one morning, and it was just what I had for breakfast, which is this smoothie that I make, right?
Okay, I didn't know that. Actually, this is totally, okay, awesome.
So when I transitioned to ancestral eating, I ate eggs every morning, right? And then I got sick of it, and I didn't want to have eggs. And in fact, I even got sort of grossed out by the idea of eating eggs again. But I really understand the nutritional value of the egg yolk, right? And so I thought, well, how do I get this in me? So I made up a smoothie recipe, which is essentially a lot of natural fat. So it's coconut oil and ghee and raw pastured egg yolks, and nut butter, and then and then it's you can use coconut water or almond milk or whatever you want. And then I like cherries, so I use frozen cherries and cocoa powder and gelatin. And the gelatin is basically like an amino acid base, high glycine, and essentially that's really simple smoothie to make, and it never gets old. It's like delicious, and it keeps me full, lunch. So it's like hours.
Okay. Yeah, that's sustained.
Yeah.
Awesome. And you make that every morning?
A lot of mornings. Okay. A lot of mornings. Sometimes I'll go back to eggs. Sometimes I'll eat leftovers from dinner. Mm-hmm. Like I know it's not beyond me to have chicken soup or I'll have rice and meat sauce for breakfast. Yeah. I don't know. Yeah. It's like an American thing to think we have to have dessert for breakfast.
Yeah. But I'm really glad you were talking about this because this is totally not scripted. Anyway, we didn't talk about that before. But that's exactly what I work with as well. A lot of times is that savory food, right, for breakfast. In fact, my next cookbook is going to be called Savory Breakfast.
Perfect. I will be one of the first to purchase it. I want an advance copy. Perfect.
So I know that you work with a lot of. Actually, let's talk about first the thing we touched on before that. A lot of people who come to you will say, I want to get a thyroid medication, and I get the same thing, or I want to get off bioidentical hormones. I'm not sure about this whole progesterone, estrogen patches or creams, and for good reasons. But not many women, and in fact, I can't remember really one at this point who would have come and said, I'm on antidepressants, I want to get off those. Let's talk a little bit about that, because that's my audience. I know many of you are, or been asked to go and be on one. Why is it happening, and what is wrong with SSRIs? I know it's a big question.
Yeah. I think the most important foundational principle is that, for the most part, we need to teach ourselves that the body can heal before we are willing to take away medications that we really have developed an intimate relationship to, like psychiatric medications, right? Or maybe we even think that we're alive. So for many of my patients, they need to learn about bodily healing, often through thyroid healing. Sometimes it's through, putting their Crohn's disease into remission. Sometimes it's their, other autoimmune arthritis, etc. Even reversing type 2 diabetes. They need to learn that the body, through largely nutrition, is capable of spontaneous healing and self-directed healing. Because then once they internalize that experience, they have fundamentally more trust in a scarier process, which is coming off of a psychiatric medication. And only then do they think, oh, wait, it wasn't the Prozac that was making it better, right? Like I see patients all the time on medication. They still have a number of symptoms, right? Sometimes even a number of side effects. So, they can have brain fog, they can be struggling with hair loss or weight gain or constipation, bloating, gas, joint pain, and, they've been on Prozac for 15 years, let's say. So then when we engage basic lifestyle interventions and they feel remarkably better, their energy is better, their libido is back, their hair and skin are, healthy and glowing, their digestion is normal, only then are they able to say, that Prozac wasn't doing this, right? I don't actually need it to feel this way. And then there's almost like this loosening that happens where they begin to say, well, maybe I'm ready for a next chapter. I'm ready to address my mental health in a different way. I was absolutely trained as a conventional psychiatrist. I believe very much that health is just one prescription away. For the better part of my career, I had a lot of faith in the conventional model. And so the science that I have come upon in the past, 8 to 10 years has been shocking to me, truly. It took me a long time to even accept that this was actually in the published literature. And essentially what the science shows is that what we've been told about how antidepressants work, and really psychiatric medications that just focus on, is not accurate. And what we've been told about their safety is also not only not accurate, but largely not studied. Like we're just beginning to learn about the effect on the microbiome of certain medications. Never looked. But what's really concerning to me is that coming off of these medications can be really, really challenging. And that's not anything I ever told a patient before I wrote my first prescription, right? So that's called informed consent. And informed consent is really not available to most prescribing doctors today because they haven't been exposed to all the science that's out there. It took me a long time to see the full picture. So some of the reasons why I think it's worth reconsidering, either if you're on an antidepressant or if you want to avoid one, or if for whatever reason you are considering tapering one, it's worth considering the root cause, right? So we're not trained to ask why, right? So when you're depressed, it can be because of a number of different things, ranging from physical to spiritual. And your answer is really relevant because I believe it's always reversible, or it's always something that you engage with and integrate, experience meaningfully. And so if you don't ask that question, then you never get to fully manifest, I think, who you're meant to be. So it really becomes like almost an existential question. Yeah.
Yeah. So for those who are on antidepressants right now, first question, is it completely possible to get off?
So I am very attached to believing passionately in stability. I really think there's no limit. And so I would say it's always. That being said, it can be extremely difficult. Mm-hmm. And the longer that you're on medication and the more medications you're on, the more challenging it is. Mm-hmm. And, I would actually go so far as to say that psychiatric medications on the whole, but actually SSRIs specifically, are the most habit-forming. Because I don't ever hear about people who need to be taken off of alcohol or cocaine or heroin or OxyContin by 1,000th of a milligram. Right. But some of my patients need to be, discontinued at that pace.
So I think it's also important for people who are not on antidepressants yet, but have been pushed in that direction, who are thinking about going that direction. I mean, this is a really great insight as well, just to understand the consequences of that and how hard it is to get yourself off it.
Yes. Yeah. I mean, I would say that really this approach applies to all categories, whether you're on and you're not feeling great, whether you want to come off or whether you want to avoid it. The first order of business is optimizing your physical health and your stress response,
Yeah.
no matter what. I don't taper, 1 milligram of medication before that happens.
Yeah.
So it really is an experiment worth doing no matter what category you're in.
So let's talk about and this is, by the way, this is the book. It's right here. What are some of the key principles that you work with when it comes to the underlying causes of depression?
Yeah. So I found that while I just said that there are millions of reasons probably in any individual case, for how we are manifesting psychiatric symptoms. And again, that includes bipolar, ADHD, OCD, panic attacks. These are just symptoms. They're just labels, right? They don't actually correlate with a heritable disease. That's why psychiatry is very different, because we don't do blood tests or brain scans or EEGs. We don't do any of that. We just have a conversation and we assign a label, and then what goes with the label is a pill. There are a lot of limitations to that approach. So what I found is that there are some very common physical causes. I call them psychiatric pretenders, right? These physiologic imbalances that can masquerade as psychiatric. And if you don't have someone, including yourself, asking the right questions, then you can end up on a psychiatric medication for a long period of time that actually, can cause notable side effects that, according to the long-term literature, ends up not being the best option for the outcome.
And before you go on to the causes, do SSRIs actually help?
It's a great question. So I certainly believe that, right? I had patients who came in and told me, I feel so much better, 6 weeks on Prozac. And what's really hard to accept is that the literature actually shows us that they're not effective. And shows us that they have an efficacy rate of about 30 to 50%, which is not so hot, right? Think flip of a coin. And then further, the literature shows us, primarily research done by a psychologist named Irving Kirsch, who's arguably a placebo effect expert the world over. What he demonstrated through his analysis of unpublished literature, it's a big deal in psychiatry, is that pharmaceutical companies hide all of their negative data. And it's a big problem. It's actually permitted by.
Wow.
So when you include that unpublished data, you find that what we're looking at is negligible efficacy. And he argues that most of what people are imagining or thinking or experiencing as benefit is from something called the active placebo effect. And that many people feel offended and affronted by that, because they think, oh, you're telling me it's all in my head, or I was fooled or duped. Like, no, this totally worked for me. It's not what we're saying. What I am reporting on his research is that the placebo effect is actually one of the most sophisticated physiologic effects known to medicine. And it starts with a belief. Where do you get this belief? That when you are in a trial, you have a headache or gastrointestinal distress, and in the treatment, it's fixing me, right? You get this belief from the advertisers. We are one of the 2 countries in the world that allow for this kind of direct-to-consumer advertising. So that belief activates all sorts of things. And there's a ton of fascinating research on the placebo effect. It's a very real thing. So
a lot of it is all here.
A lot of it is in there, and it actually applies to all branches of medicine, including surgery. We're beginning to learn that what you believe about your treatment may be the most important factor of its effects. But then there's another layer which is worth mentioning, which is that, like any chemical, including cocaine and alcohol, these medications have chemical effects. And they may be sedating, they may be a little energizing. You may like that. That may be adapted, just the way if you're socially anxious and you go to a party and you do a shot of vodka, you feel better, right? So you may like that, but we sort of all know, if we think about alcohol, that we wouldn't want to use that as a daily treatment, and then you could get into trouble long term. Yeah. And so what in the published literature now we're seeing is that this category of medications is, so it has a chemical effect, which has a cost. And then much of what is driving your perception that it's helped you is your belief that it works.
Wow, that's so fascinating. And one of the things that Kelly talks about in the book, and I'm going to leave that for you guys to read in the book rather than talk about it, but it was fascinating to read that depression is nothing to do with low serotonin levels, exactly. Right? But you said in your book that there is so many patients actually have high serotonin levels when they have depression. So we're going to leave that for the book for you to know why.
Myth busting.
Yeah, so that's a big one, right?
It is. It is
for up with that. I mean, I went to nutrition school with that.
Yes,
information.
exactly. In the alternative and holistic realm, it's still very prevalent, but it's a mirror reflection of what we've been told by pharmaceutical companies, using amino acids like tryptophan and 5-HTP, and honestly, even St. John's wort, thinking about it like a natural SSRI.
Mm-hmm.
We don't want natural SSRIs. Like, we want to actually find out what is driving your symptoms and go in there, right? Not just like think of this as some magical chemistry problem, because it's really.
So let's talk about the causes. Back to that.
So some of the most common ones, I would say, I treat women in my practice, and one of the most common causes, is something I dealt with personally as well, is unstable blood sugar. So it's reactive hypoglycemia, although I do see a lot of women who are, thin and beautiful, who are on their way to. If nobody, took a look at their fasting and blood sugar and hemoglobin A1C, they might have no idea, right? This is major because it can really masquerade as some pretty serious psychiatric pathology, including even bipolar disorder, panic attacks. I talk about a patient, my most remarkable case in this regard, who was having 6 panic attacks a day on her way, believe it or not, to electroconvulsive therapy, because she was on multiple psych meds just out of a hospital and nothing. And she was very motivated for dietary change and put her on a high natural fat diet. And she, within 1 month, came back and said, "This is the first month of my adult life I've not." By that time, I had her labs back. I knew that all we did was stabilize her blood sugar. It's a major driver of brain fog, of course, of even chronic fatigue, and a lot of what we are calling depression. Because depression today almost always has a layer of irritability and agitation. It's a very, very common experience, and so this kind of like fluctuation of blood sugar can be a major driver. Another one, a big one, of course, is hypothyroidism. My own experience putting Hashimoto's, into remission. And that's really what taught me. Remember, I was saying about healing the body. That's what taught me, wow, I didn't learn about this in medical school. There must be more to the story about autoimmune conditions and managing them just with hormones. Synthetic hormones doesn't make any sense, right? Sort of turning off the smoke alarm but letting the fire burn makes sense. So if you look, I was telling you earlier, if you look at the symptoms of hypothyroidism and you look at the clinical criteria for depression, they line up almost like mirror images. Yeah. So, and Hashimoto's, and specifically postpartum thyroiditis, and shifts around any, menarche or menopause, shifts around any endocrine window, are very critical to examine when we're talking about symptoms. And I really encourage people not to think of the psychiatric symptoms, right? So it's not like you have a hormonal issue or an autoimmune-driven hormonal issue, and then you have psychiatric symptoms. They're all part of the same animal. And when you balance and reverse autoimmune hormonal conditions, your psychiatric symptoms will also. So that's another major one. I'm very interested in food intolerances, specifically, of course, as we all know at this point, gluten and dairy, because I have been deep in the literature that suggests that these are very active. The metabolized proteins are very active at the brain level, and not only at the gut level. And it's something that we need to look at. So there are papers that are literally randomized crossover trials looking at gluten-induced depression. And then there's even data in schizophrenia, looking at gluten withdrawal and resolution of symptoms. So it's not an issue for everyone, perhaps, but it's worth controlling for if you have any history of a total, no pun intended, no-brainer. Yeah, so I would say those are the primary ones. And then there's specific nutrient deficiencies, like B12 is one I'm very interested in, very easily replaced. And, again,
like one in form of IVs?
I normally do intramuscular injections. I have my patients do it themselves, so they get it from a compound pharmacy, and they put it in their arm or their leg, and you bypass the complicated absorption of B12 at the gut level. And I've taken literally suicidal patients off my couch with high dose, but I use normally 5 milligrams of hydroxychloroquine a day for 3 to 5 days. So it's a bit aggressive, but it is a water-soluble vitamin. But yeah, so these are sort of some of the typical imbalances.
Let's another question I want to ask you is I was fascinated by the LPS you talked about in your
Yes.
book. Can you just talk a little bit about for those of you?
Yeah, exactly. Right. So you can go deep on this one. Yeah, so there's been about like 20 years of literature looking at what's called the cytokine theory of depression, right? So in the scientific world, they've abandoned the chemical imbalance theory. I mean, no one of any reputable station is actually investigating that anymore. So they're looking at depression as an inflammatory condition, just like autoimmunity, cancer, diabetes, heart disease.
Hashimoto's.
Exactly. Just like all of these chronic diseases that largely didn't exist in their current form 100 years ago. So it's what we call the diseases of civilization, right? And so in the animal model of depression, they induce depression in the animal, whatever that means, by injecting it with LPS. LPS is a component of gram-negative bacteria cell wall that's naturally occurring most of the time in our guts. But when it traverses the barrier, so in the setting of what's being called permeability or leaky gut, then there can be a cascade of inflammatory messages that result, right? So if you inject LPS into these animals, they develop a depressive phenotype, right? Yeah. And so what does that tell you? It tells you that the gut integrity is really relevant to behavior, right? So we know intuitively that the brain has a, right? We've all been nervous, had diarrhea, or lost our appetite. But we're just beginning to appreciate that it goes in the other direction too. That what's happening at a gut level in terms of digestion, in terms of immune response, in terms of inflammatory signaling, in terms of that ecology and the balance, very complex balance of bacteria, viruses, fungus, and others, speaks to our brain directly, right? We think it happens mostly, but not always, through a big nerve called the vagus nerve that connects them, right? And so that's how the brain understands what's going on in the environment. And that's also why diet and nutrition is our most powerful tool, because it's the way to speak not only to our gene, but to our brain about what's happening.
Awesome. Do you have any favorite exercises for stimulating the vagus?
So I actually, you know who I think is really been a wonderful influence for me is Tatis Karazian.
Okay.
Yeah, and he taught me for my patients about gargling and the power of gargling. So I'm very into these like no risk, very potentially high yield.
Tell us a bit more about that for the audience, because that's in his second book, right?
Yes, his brain book. Yeah,
Brain Maker.
It's why is my
brain not working? Yeah,
his titles crack me up. Yeah, so he talks about how you can stimulate nuclei in the brain by aggressively gargling. You know, so over the course of a day, you could do like 3 glasses or so, and you can try it with my patients. And that you stimulate the gut-brain vagal connection in that way, even almost till you're tearing. Oh wow! So it can't be like gentle.
So do you? I mean, you should take a glass of water and
take a sip and you aggressively gargle it.
Right. Yeah. And do you see good results with that?
Yeah, it's difficult in terms of compliance. That you know we're so used to popping pills, even supplements, that you know it's a weirdly difficult thing to latch onto. But that I think in terms of stimulating the vagus nerve has been my go-to. But
how do you find? What do you think about like diaphragm breathing?
Well, that's where I was going. Yeah. Okay. So I'm a huge, very devoted practitioner of Kundalini yoga, and it's completely changed my life. It's literally rewired my nervous system, because even after putting my Hashimoto's into remission and you know getting my digestion back that I never even knew was gone, and you know all of these, my hair stopped falling out, obviously, as you can see, the mop I have on my head. You know, I still was very high strung, very type A, anxious, really sort of still struggling with feeling just out of control of my life all the time. And so Kundalini yoga is one of the oldest forms of yoga. It's thought to be one of the only ones in the branches of yoga that recruits all of the different technologies, from breath work to, you know, mental focus to hand movements or mudras, and then to physical posture. So it's a very different kind of yoga than you're thinking of if you haven't been exposed to it. It's not like down dogs and you know, up dog kind of thing. It's very
no power yoga there.
No power yoga. Yeah, it's specifically designed to stimulate the hormonal system, glandular system, and the nervous system in specific ways. So, it'll have repetitive movements or very sort of strange breath work. And it's all in service of toning the branches of your autonomic, parasympathetic, and sympathetic. Those are both important. And so, I'll have patients sometimes start with 3 minutes a day of left nostril, which is a way to stimulate that relax, digest. It can be a really simple. It's how I started, because I was never someone who could do mindful meditation and just think about watch them float by or whatever. I couldn't do it. I was too crazy, right? Yeah. So for me, this having something more to do, and the more, some of the meditations I talk about in the book are a bit more active, right? It gives you stuff to do, and it actually, while you're doing it, you're toning your nervous system. So for me, I'm living proof. I don't experience stress anymore. I have 100% trust in the process of life, and I don't feel like I have to manage it. I just am receptive, and even difficult or challenging stuff, like when we learned about the blacklist, I'm totally fine with it. Everything takes on a different hue when you can just be receptive instead of gripping, reactive. Yeah.
Awesome. All right, you guys. Link is gonna be down below the video for the book. Cool. Do you want to tell us anything about some final parting thoughts? And who is this book for? What did you envision for the book? Can people DIY it completely with this book?
Yes. Yeah. That's the whole point. There was a time where I had a 1.5 year wait list. There is no way I can help every single patient. And guess what? I don't need to, because what I tell patients after a first consultation is in there. And, there will be a companion course coming out in early May called Vital Mind Reset, which is just for people who want to go a bit deeper into this work. But it's interesting, who's it for? It's obviously, I work with women. I'm a feminist at heart, and I'm very interested in women's empowerment. But the truth is, it's totally gender neutral material. It's just the cover is really the only where the gender details end. But so I really think it's for anyone who's struggling. If you're struggling, then much of what you're doing may not be working well, and so it's a toolkit. It's tools for transformation, as I like to call it. So again, whether you're on meds, thinking about them, or wanting to come off them, it's all the same starting point in terms of beginning to speak to your body in a different way than we've ever been taught.
Absolutely. And your book has some great recipes there at the back as well. But really what's fascinating about this is that so many things in the book are very similar to what I've been talking to my community anyway. So the gut healing, you obviously go very specific on depression and some of the supplements and things you test for, which would be super helpful. And so I think really anybody who has a family member or they themselves are struggling with depression. What about anxiety? Are you covering? Would that help anxiety as well?
Like I said, I honestly can't even think of a patient I've had in the past 10 years who doesn't have a little bit of both. Yeah. They feed into each other, and in terms of underlying root causes, they're very related. Yeah, so the truth is, I actually do the same thing for pretty much everyone in my practice, whether they, I see schizophrenics, I see bipolar, I see OCD, I see it all. And this is where I start. So I think it's a really good template for starting.
Awesome. Last question I think I would have is, I wonder whether you have the kind of experience where I've had women come to me and say, just by eating differently, my personality has changed. Yes. Do you get that?
So it's interesting because so many patients come to me and they think, I just want to get rid of my symptoms. I want to sleep better. I want to feel more energy. I want my libido back or whatever. And that is easy. That can take a month or two. But what's really so much more interesting is the transformations that happen, right? Because once we move through the physical healing phase, my patients leave their husbands, they move to Europe, they adopt babies, they suddenly almost wake up to these things that were being tucked in the closet. And now they feel ready to meet these challenges and to make these changes. So it's so fascinating. Every day I'm with a patient who's just moving into that zone. And I almost feel like smiling because it happens every time, particularly when I'm taking patients off. And, I spoke to someone this morning who's on 4 milligrams from 150 milligrams of Zoloft, and she's starting to speak about all of these things. She's just woken up to a different sense of her own empowerment. And even that she doesn't even feel so much like she needs me the way she did. It's all giving her agency back. So much of what we thought about as our personalities, like I told you, I always thought of myself as being very high strung and controlling and very type A. And if, people who meet me today find that so surprising, that I would ever have described myself as being like this very aggro sort of like, because apparently that wasn't my personality. Apparently a lot of it was even blood sugar, or a lot of it was my thyroid, and certainly a lot of it was my perception. So it's very interesting what we get used to and how much is very fluid when to come into alignment.
Yeah. And I especially love the life changes that you talked about, like how it really into getting, just really discovering that there's so much more that we can do. We're capable of doing. We never saw that before. Like there's this other side that we just haven't even seen yet because it was behind the screen.
100%. Yeah. Look behind the veil. Yeah.
Exactly. Awesome. I'm so glad we got to catch up.
Totally. This is so much fun. It's so wonderful to speak, to like-minded audience.
Yeah. Thank you. I hope you guys enjoyed the interview, and I'll see you soon.
Great.
Thank you.
Oh,
this was fun.